Good afternoon, all. Welcome to the webinar, Blind Spots in Mental Health Care, Finding the Right Therapist for Overlooked Populations. I'm Tabia Lee, a senior fellow with Do No Harm and lifelong educator dedicated to raising awareness about ideologies in practice. Political bias has led the mental health field to neglect countless crucial issues, from patients who self-censor to masculinity issues, and from victims of anti-white aggression to people attacked for their political views. Many people have these experiences develop psychiatric symptoms, but despite their prevalence, they are likely one of the most underserved patient populations in the country. This talk will overview many of the most important issues that the mental health field is overlooking and offer ways that medical providers of all stripes can help to address these problems. To speak on this subject, I'm excited to introduce our distinguished speaker, Andrew Hartz, PhD. Dr. Hartz is a practicing clinical psychologist and the founder and president of the Open Therapy Institute. He was formerly a professor in the clinical psychology doctoral program at Long Island University, where he also completed his PhD. For several years, he has written about political issues in mental health and recently served as a writing fellow at the Heterodox Academy. He completed his clinical internship at Columbia University Medical Center and completed training at Mount Sinai Hospital and the William Alanson White Institute. After the presentation, Andrew will be happy to answer your questions. You may submit questions using the Q&A button at the bottom of your screen throughout the program, which will be addressed during the Q&A period. You are welcome to submit questions anonymously, but please note your question and name will not be visible to attendees. So without further ado, we will get started. Welcome, Andrew, and thank you for being here today.
Thanks, Lee. I'm really excited to talk about this important issue of overlooked issues in mental health care. I think a lot of people here who are coming to this talk probably know about some of the more extreme biases that happen in mental health. Issues related to patients being attacked for their views, bringing identity politics ideologies into session, centering white privilege in treatments where it's not relevant, or even therapists refusing to treat patients with certain political views. And there's been more documentation of that stuff. But I actually think the biggest scandal in mental health right now are these overlooked issues, all the things that the field could be doing to help so many people and isn't. And most of these issues that I'm going to talk about today are almost entirely absent from the academic literature, they're absent from training, and then they're absent from clinical services, meaning it's very, very hard to find a therapist who clearly states that they specialize or work with these issues. So I want to start by just giving a brief overview of what I'm going to talk about, and I'll show this image. So this is kind of an overview of what the Open Therapy Institute does, and you can kind of see that first column on the left has to do with the different types of problems in the field right now. There's overlooked issues, overlooked populations, overlooked perspectives in mental health, and there's also problems with lack of skill, bad practices, and other biases. And so what the Open Therapy Institute tries to do with that is offer therapy referrals for people who want a therapist who can work with these issues, offers training for therapists, and does research and scholarship on these topics. And then we hope that they have these positive social benefits that can lead to broader social change and improve mental health care. But for today's talk, I'm really going to be talking primarily about the stuff that's in the left column, and I'm going to be talking about therapy referrals at the Open Therapy Institute. So just to kind of dive in here, let me show this PowerPoint. Okay. So what are these overlooked issues? What are the issues that mental health field should be addressing and isn't? This is a really big one. I'm just going to go through, there's probably 20 some odd broad categories and different subcategories within each one. But this first one is really important. How do social forces shape symptoms? So I'm going to tell one quick example. Dean McKay at Fordham has done some work. He's an expert in obsessive compulsive disorder, OCD. And what he's found is that more and more people who have OCD report that they have obsessions. These are repetitive, intrusive thoughts that are about cancel culture. They don't want to say or do something and they'll get labeled racist or sexist, or they'll go viral on social media and get canceled. So they have these repetitive, distressing thoughts about saying something on PC and getting canceled. And this is really at the heart of their OCD symptoms. So this is going to shape how they come into treatment and what they're going to need to talk about. And it's going to be a focus of therapy. But social forces shape symptoms in other ways. Think about somebody with an anxiety issue, like a social anxiety issue. And now they're at an office place and there's kind of Me Too stuff going on, maybe lots of accusations of bias around gender. Their social anxiety can latch on to those issues of gender, and I don't want to say something that's going to upset somebody around that issue, and their anxiety can focus on that. Or if they're depressed and now they have to go to workplace trainings that focus on it, maybe they're very demeaning towards certain groups like white people or men or something, and that could contribute to depression, or it could contribute to anger disorders or substance use. So basically almost any clinical symptom that people could have can be shaped and exacerbated by these social forces. So what do we need to know about this? What are the socio-political stressors that people are dealing with that we don't have a literature on, like cancel culture? How do they contribute to mental illness? How do they shape symptoms? How do they come into therapy? How do therapists respond poorly? How should they respond better? What interventions would help these populations? What does it say about the larger culture? We don't have papers really on any of this. We don't have trainings on any of this. And as far as I know, there aren't therapists who specialize in any of these issues. Okay, I'm going to kind of move at a quicker pace to make sure that we can get through all of this. But another one, people attacked for their beliefs. It could be harassment at school, harassment at work, being discriminated against or antagonized. It could be, and each of those experiences is a little bit distinct, which is worth keeping in mind, that like being ostracized or not getting promoted is different from being harassed. There's also people who face false accusations of bias. And they can't defend against it, and their career stalls, or they go through some weird committee to try to exonerate themselves, or another one, people falsely accused of sexual assault. I know somebody, it's actually a friend of mine who had a friend who was a student who was accused of a rape. And it came out in the accusation that the accuser had said in her text messages that she was making it up, and she admitted to making it up in her text messages. So he ended up getting exonerated, or he was acquitted. He sued her for defamation. He won. She couldn't pay the damages, but he did win. And yet the accusation continued to haunt him and affect his career, affect his social relationships. And it was years of time in courts. And after all of that, shockingly and disturbingly, he ended up committing suicide. Another example, people facing DEI discrimination, people who lose jobs and can't get promoted because of policies that are discriminatory. Questions about this. How have these experiences changed recently? How do they impact mental health? What helps therapeutically? What are they experiencing? How do we help? What does this say about society? A really big one, we have a workshop on this coming up in September, but it's about self-censorship. How does self-censorship impact mental health? When you can't say what you feel and you can't express what you believe, that could be seen as contributing to all types of psychological or interpersonal problems. It could also institute social and institutional dynamics. The experience of it is also interesting, where, it's not, sometimes people are overestimating the risk of speaking up, and sometimes they're not. And sometimes they're not thinking strategically about what to do. like, so they might um, lash out or kind of have an explosion that's not helpful to them. So we just want to outline all of these different experiences. It's an incredibly common experience to be self-censoring at school or work. And it also comes into the therapy room. Patients self-censor with their therapists and often take a long time to finally reveal that they have beliefs about issues that are really important to them, but they're afraid that if they share them with the therapist will respond judgmentally. And we don't have interventions to deal with self-censorship. We don't have evidence-based treatments for it. We don't have community-based treatments for it. I mean, it would be really great to have resources that institutions could use to overcome censorship cultures that might have developed. Um, Similarly, therapists need to have skill working with patients who have diverse socio-political values. It could be conservative, libertarians, moderates. A lot of people that reach out to us are actually liberal. They just don't like aspects of current identity politics. Religious patients. Not all religious patients want pastoral counseling. Sometimes they want general psychotherapy, but that doesn't mean that the therapist can be totally oblivious to religious and spiritual concerns and how they impact the patient. Values are so central to the therapeutic process. People who don't know about therapy might not know that the best predictor of outcome in therapy is the therapeutic relationship. That's called the therapeutic alliance. And it's basically mutual trust, shared values, a connection, things like that, shared goals. And it's really hard to establish that if the therapist is entrenched in a worldview that is really disrespectful to the values and views of the patient. So therapists have to have some awareness of what different socio-political values are, some respect for them, some comfort and curiosity with them to facilitate an open, constructive therapeutic relationship. So I think that even therapists who think that they're not biased, they say, well, I'm not yelling at my patients who I disagree with, but that doesn't mean they're attuned. It doesn't mean they understand them. And a lot of times they're totally oblivious to the signals that they're sending that are communicating they don't get it. I'll give one short example. If you look for a therapist in New York and probably most parts of the country on Psychology Today, most therapists right after their name list their pronouns. The first thing after their name is their pronouns. They think, for the most part, that they're being inclusive by doing that. They think maybe the patient's trans, they know somebody trans, I'm signaling inclusiveness. They're not aware that there might be people who have a kid who's questioning their gender and the parents are concerned, or they might know somebody who detransitioned, or they might have religious objections to this ideology or other objections to the way it's being practiced. And by putting your pronouns, it's a signal that you're not open to all of those people. It can also just be a general signal that you basically support leftist views on a lot of things. And so anybody with conservative views sees that, they might think, this is a therapist who I can't speak about these issues with. Most therapists are totally oblivious to it. And it's right on the profile. You can see it just when you search. And I think that there's countless other signals like that that therapists often send patients, and it harms the therapeutic alliance. And I think it often harms outcome because of that. But again, there's virtually no research on that. Another really important issue is anti-white aggression and bias. I wrote an article for City Journal about this about a month ago. The field writes a ton about race, but the dominant ideology now is that racial aggression directed at white people is not racism. And so the main focus when they write about it is to diminish it as not being as important. There are a lot of people who experience these things. It can be violent attacks, including rape and battery and murder. There's also children who are bullied at school. Schools, I think, are very poor at responding to those situations. Workplace hostility and other types of insults and demeaning language in the larger culture. This really affects people. It's not it's often something that they feel strongly about, and I think it would be beneficial to talk about in therapy in a constructive way. There is basically no literature on it. And there are essentially no therapists in the country who say that they work with this issue. There's almost, I don't know of a single training that exists on this topic. And it's very likely that a lot of therapists today mishandle this. They want to steer the conversation back to white privilege, or they believe that these attacks aren't racism, or if the patient is angry or feels invalidated by the experience, they think they don't have sympathy for it. Um, you know, there's a lot to say about the experience. It's weird because these experiences are so common, but they're so often excluded from discussion in the larger culture. So they're kind of collectively dissociated, which makes them harder to work with in therapy. And even the victims are afraid to mention this stuff often to the therapist because they think the therapist is going to judge them the way other people might if they're frustrated and maybe feel traumatized by some of this or hurt in other ways. So we want to understand, how does this impact people? How does it shape symptoms? You get the idea. How should therapists respond? There's almost nothing there. Similar with masculinity issues, I'm going to move at a much quicker rate because I'm not going fast enough. Masculinity issues. Adolescents in particular, young men trying to develop a positive sense of masculinity in a culture that often demonizes masculinity. If masculinity is framed as toxic, then young men have to choose, do they want to be toxic and male, or do they want to be good and emasculated? Because those are now mutually exclusive. So that's a real challenge. And some might respond by taking on an emasculated identity, and others might respond by taking on even a psychopathic or aggressive identity, because that's the only way that they feel like they can really be male. I think that's a big challenge, and it doesn't just affect young men, but I think it's especially relevant to adolescents. There's dating issues, a lot of questions around dating culture, if they're having a hard time finding somebody who shares their values, or there's tension around gender issues in dating. This is actually really important, is gender normativity in couples therapy. If a couple is conflicted about gender roles, as a lot are, therapists, I think, are often timid at addressing it because it's uncomfortable to think that maybe there's part of each of the people in the couple who are attracted to some elements of what we might call gender normativity or traditional gender, as a lot are. And that can play a big role in conflict and disharmony in relationships. But I think it's often ignored in the literature, and I think it's often ignored in treatment. And if you're in a relationship that has elements of a traditional gender role kind of marriage, as a lot of people do, couples therapists, I think, tend to be pretty oblivious about those dynamics. Same thing with issues in families. There's also a question of anti-male bias and aggression, which happens more than people might think. We need research on all of it. Another big one is university culture. A lot of students are really struggling if they have a minority opinion on campus, because there's often a culture where professors and administrators, as well as their peers, antagonize them. And so they often have to lie about their beliefs almost constantly, not just on papers in class, but even at social events. That really takes a toll on people. Anti-Semitism is another big issue, most recently on college campuses, but in a lot of other spaces. And despite the fact that historically psychotherapy has had a lot of Jewish leadership, that more recently a lot of professional bodies have taken on an aggressive, uh, anti-Israel politics, shockingly. And it's really it came to dominate the field, I think, in a lot of places over the past year, especially. And so I wouldn't assume that any therapist can work with people struggling with anti-Semitism. Far, far from it. Um, Other issues too is gay men and lesbians who dislike aspects of LGBT culture. It might be disagreeing with trans issues, but it could also be, I'll give you a real case example of somebody who was a young gay man and his friends told him, and he wanted a committed relationship, and his friends told him, "Oh, gay guys don't do that. We don't have committed relationships. You just have open relationships and you hook up, and we don't do that." And obviously that's not true. But there are challenges with deviating from dominant themes in LGBT culture. And some gay men and lesbians are conservative, or they're religious, or they don't always necessarily fit in with what's branded as what the culture is supposed to be. Obviously, that's also true for a lot of people of color, Black people, people of every race and ethnicity. They often, these racial and ethnic groups have a leadership that kind of seems to set the agenda as these are the values you're supposed to believe. And it can pose real challenges, obviously, about being included or attacked by your group, and being kind of having a lot of stuff done in your name that you don't agree with. Um, I think there's a ton to say about both of these issues, but I'll move quickly. Um, Sexuality and gender, obviously transgender medicine is a key issue, especially in psychotherapy. Kids questioning their gender, even adults, they need to find therapists who are skilled in this area. It's often hard to find them. There are organizations that do that. Open Therapy Institute works with Therapy First for kids who are questioning their gender identity. But there's other issues too, especially the parents. Parents of questioning kids often really struggle and feel unsupported by the mental health system and distrustful of it. There's people who detransition or desist from a transition, and they often feel misunderstood. A big one is number C. I don't think this, or letter C, I don't think this has gotten enough attention, which is people who are on inpatient units. And these are often these are adults usually who might have had a psychotic break and developed symptoms of schizophrenia. Now they're on an inpatient unit. And what if they start questioning their gender on the inpatient unit? They're very vulnerable to being quickly affirmed. And it's important to, I think it should be important to stabilize the psychotic symptoms first before proceeding with the transition, but that's not always what seems to happen. Other questions about asexuality or demisexuality and other letters of the acronym, there's little about it. And, there's concerns that people with trauma histories in particular might, or interpersonal difficulties, might latch on to some of these labels, when maybe they are really avoiding trauma or really avoiding dealing with with an interpersonal issue, and they latch on to a label. Consensual non-monogamy, polyamory, sex clubs, orgies, that stuff is becoming more and more common. I see a lot more of it in New York, but it's not really thought about critically in a clinical context for a lot of therapists. I think a lot of therapists there feel like they have to affirm all of this stuff automatically, and they don't think about what this could mean for couples or relationships, or people who have trauma or drug abuse histories, and how this could potentially be harmful to them. I'm going to go quickly through these last ones. A lot of parents and couples are dealing with political conflict and disagreement. The therapist needs to be attuned to both people. If the therapist is strongly aligned with the left-leaning partner, that's not going to make for a good treatment. And I think a lot are, and they're oblivious to how that might bias them. Another important issue, DEI programs. A lot of DEI trainings, I suspect, have a big toll on mental health. Some of them are hateful. They forbid certain people from speaking, maybe based on race or gender. They might attack pretty viciously some groups and call them toxic and praise the others and things like that. Authoritarian personality disorder. It's not really a disorder, but I guess it's left-wing authoritarianism, authoritarian personality structure. It's the psychology has a ton of literature on right-wing authoritarianism, a ton. It's got much, much, much less on left-wing authoritarianism. Um, there's concerns about intensive parenting of kids that might overwhelm parents and actually harm the children rather than fostering independence. Um, Law enforcement, police officers and their families, veterans. I think another thing that the field doesn't do very much of, and I'm approaching the end now, but another thing that the field doesn't do very much of is formulating what's happening in the larger culture. There's more and more trends of all or nothing thinking, especially around identity politics, um, arts and culture, conformity dynamics, safetyism. I don't have time to break all these down, but um, people understand that there's something crazy about the culture. And you can see people reaching for psychiatric sounding language to talk about mass psychosis or whatever it is. They know that things feel really unstable on a psychological level in the culture. But I think they're struggling to really formulate it in a clear and accurate way. And I think there's concepts in psychology that could help do a good job with that. A number of other issues, I'll just kind of race through these. Forced maskings and lockdowns, how those impacted mental health and maybe continue to impact some people's mental health. Crisis of meaning, the psychology of activism, discomfort with power differentials in society. The growth of the racial schema, where I think we're being conditioned, I think, by media and education, other institutions, to see race first and think about it constantly. And it's people are totally preoccupied with this, and they're not aware of all the things that this is leading them to miss. I went to a church, a beautiful cathedral with an old friend of mine, and when we got done, he made a comment about how Jesus had blue eyes, and that wasn't historically accurate because it's this white European Jesus. And I was thinking, think about all the things you could have commented about this cathedral and the architecture or the history or philosophy, theology, anything. And this is what people, and when I taught in grad school, it was the same thing. People would focus on those issues first. I'm going to race through some of these others. There's also obviously the extreme biases in the field, bringing race into sessions when it's not part of the presenting problem. This is another disturbing trend too that people might not have heard of, but queering clinical spaces, queering the therapy institutes, queering hospitals. That seems to mean deliberately trying to break down the gender binary. These patients are often extremely vulnerable, and they go to a hospital or clinic for treatment, and they're unaware that the place is actually trying to break down everybody's gender binary. And they didn't consent to that type of treatment necessarily. It's also not evidence-based that helps anyone. So I'm going to have some. A lot of therapists will just not treat conservatives or anybody who voted for Trump. Plenty of people say that openly. Centering political values in therapy when they aren't relevant. Explicit explicit political statements from therapists in their bio in the therapy room. I mean, I have a friend who went to see a therapist for panic attacks, had a Black Lives Matter sign in the window, and then he just decided not to go to the session. He didn't want to talk about politics. Now it's in the room, and he knows that the therapist has a different view than he does, and so he just left. But at a more subtle level, I think even well-meaning therapists avoid topics. A lot of therapists don't even ask about religion on intake. They don't ask about political views. And their nonverbal reactions are things that patients pick up on. It's judgment, it's disgust, it's withdrawal, it's avoidance. And there's a whole set of biases around gender, sexuality, spirituality, cultural issues that come through in the that can come through non-verbally. And therapists often make assumptions about the patient. They assume the patient shares their political views, but they never asked. They can guide the inquiry towards certain topics that the therapist values that the patient doesn't necessarily value. And this, I think, is letter E is really a giant one, which is they don't have knowledge or empathy about a lot of experiences that people with different socio-political values have. So they're really clueless and helpless, even if they wanted to be better in those areas. And then this is the last one. There are some kind of areas of biases that really have started to sink into therapeutic practice more, idealizing victimhood, demonizing parents, not acknowledging differences between men and women, favoring certain types of emotionality, maybe like tearfulness over things like humor. Um, Okay, you get the idea. There are tons and tons and tons of overlooked issues, perspectives, patient populations. Again, I think people with these concerns are the most overlooked patients in the country. We need research on that, but that's what I suspect. Here are the questions. What's the etiology? How do these things contribute to symptoms? How does it impact people? How do we formulate it? Can we understand it through a cognitive behavioral lens, through a psychodynamic lens, through a humanistic lens? There are different theoretical orientations we can use to try to understand what's happening and why. We want to know how these things shape mental illness, how they come into therapy. There's tons of questions. This is such a huge gap. All right, I want to show one more thing, and then I'll open it up to questions because I know we have a limited time. Okay. All right. I just wanted to kind of like give this, a graphical representation of what I just showed on the slideshow, which is all of these different issues that are overlooked, that are not being addressed, and also this. It can be easy to forget that these are real people who have these experiences, who are often looking for help and don't know where to go or have nowhere to go. And they might find a therapist online, but they're rolling the dice that this is somebody who's going to get them. They might take months to open up about what their experience really is, because they're afraid of that rejection from the therapist. It's college students, people who are open-minded, have mixed beliefs. I see more of that than you might think. Parents of kids who are questioning their gender, family conflicts. And so the last thing I'll say, and I'll kind of stop this. So the last thing, so what the Open Therapy Institute does for people who want to work with us is we offer therapy referrals. So if patients are interested, no patient should see a therapist that isn't skilled with these issues. So any patient who has any of the concerns I outlined should find a therapist who understands these issues. We have a network of therapists that we refer to. Patients can contact us on the website. You go to opentherapyinstitute.org and just hit the contact button and check the therapy box and email us. You can also just email us directly at info@opentherapyinstitute.org. I would really like, for Do No Harm, I'd like to be on referral lists at hospitals and clinics, if people are comfortable suggesting that. We work with providers. If you want a name, you can contact us and we can give you a name that you can pass on to a patient. Patients can contact us directly. I really think the number of people who deal with one of these issues, it might be a majority of psychotherapy patients. So we hope to really expand and be able to fill these gaps in the field. I'm going to open it up for questions now. I know that I raced through a ton of stuff, so I'm sure there's lots of questions.
Yes, thank you for that insightful presentation. I really appreciate the way that you touched on some of the overlooked issues and populations, and especially what you mentioned about the psychology of activism and the racial schema and gender identity schema that's being kind of pushed in. As a reminder, you may submit questions anonymously for Andrew by using the Q&A button at the bottom of your Zoom screen. And in the meantime, I have some questions for Andrew. So kind of touching on some of those themes that really stood out, what are some of the different ways that the training that mental health care professionals are receiving is impacting the level of care or scope of care for patients? And I'm thinking specifically of the DEI focused curriculum and training that's taking place and bias focused training. This idea that things like white privilege are something that's even real, and that's being
Perfect.
taught to therapists who then take it into their practice. Can you expound on that a little bit for us?
Yeah, there are so many ways that bias training is impacting the field. One of the most important right now is that students who want to become therapists but don't want to have to endure that training are not entering the field. They're finding different professions. They want to know where's a program that won't make me go through this. We don't have like a rating system for programs or any programs that we can recommend for people at this time. So that's a big one. They don't even get to the application. But then when you do the application, they're going to require some type of diversity statement, some type of essay on these topics, which is another litmus test. There's basically barrier after barrier ensuring that therapists coming out of graduate programs now are adhering to the most leftist identity politics worldviews imaginable. And because they think that they're opposing racism with this stuff, they feel totally self-righteous imposing this on sessions. And they're teaching people to bring these ideologies into sessions. I think there are still therapists who have good sense enough not to do what they're taught. Another really big way this impacts training that people might not be thinking about is to train to be a therapist, you really need an open environment. You really have to be able to talk about your feelings and experiences in therapy and what your patients are feeling and experiencing. If you can't have those conversations, your training's not going to be very good. So it's very hard to do good therapist training in a censorship culture. But they've really most programs have fostered censorship cultures, and a lot of people self-censor. Yeah, and then on top of it, the biggest thing is what I'm saying here, which is the issues that I talked about that so many people are experiencing. They're not getting training on this.
Mhm. And this next question is kind of in a similar vein, Andrew. So you spoke about how psychology today, the profiles has pronouns listed, and how that may even discourage some people who are seeking treatment to even go and connect with a therapist. How should people consider the social political bias when looking for a therapist? And I'm thinking especially in terms of the care environment, and some of those verbal and nonverbal cues that therapists may be communicating wittingly or unwittingly, that may create a divide where the patient feels like they can't be their most authentic self because they see a certain verbal cue or nonverbal cue or poster or other things of that nature that might be in the care environment.
Yeah. Um, I think it's hard. I mean, um, you have to read between the lines. If you're going on Psychology Today or something, you kind of read between the lines. Okay, this person doesn't have pronouns. They don't have anything here that's explicitly related to leftist politics. Maybe they're okay. Um, you can look at their website and see if they've written stuff or, but at the end of the day, I think you're rolling the dice, and that's really why we want to offer therapy referrals through our website. And we do have people over the entire country of different theoretical orientations, and I would encourage people to do that. The listings online it's hard to glean from them what's going on. So
Okay. So we will now address some questions from our viewers. If you would like to submit a question, please do so by clicking the Q&A button at the bottom of your screen. So let's take a look here at first question from our participants. It says, I have been working feverishly for the past year trying to reach and offer services to parents, grandparents, siblings, families of gender sex questioning young under 25 people, families who are struggling. How can I reach them more efficiently? I continue to hear repeatedly that parents, families are looking for a comprehensive and human health oriented therapist.
Yes. Well, you can definitely put them in touch with us. I mean, we work on in the gender space, there's more options. Recently, there are organizations that have developed. Again, Open Therapy Institute works with Therapy First for kids. So for if the kids are looking for a therapist or young people are looking for a therapist, I think that's a place that we'd endorse. For the families and for the parents and for those types of issues, that's definitely one that we treat. Um, I think these are really fraught issues. And one of the things that is lost is like this is a family. Think of this is a family that's struggling with stuff. Think about all the history and relationships and personalities in any family. They're real people. So, the dad might be passive and the mom's domineering and one of the kids is rebellious and the other one is anxiety or whatever. And they come together in this weird pattern that has this kind of stability, even if it's dysfunctional. And the gender stuff is overlaid on that. So there's probably good generic advice about, having a conversation and talking about these issues, but it's complex. It's really complex, and every family is idiosyncratic in dealing with these issues in a unique way. So I don't know that there's like a good one size fits all response. They're very fraught issues.
Mhm, mhm. And this one is more on the policy side of things. Where does the Open Therapy Institute stand on the APA's formal statements about masculinity being inherently toxic and other statements they've made, anti-Israel and anti-Zionist statements? They've been making a lot of statements. What is your stance as Open Therapy Institute on those?
The APA is really interesting. I don't know the numbers here, but I think, a minority of psychologists in private practice are members. So maybe 40% of psychologists in private practice are members. Um, and I think they have something like 10% of them vote in elections. So it's like 4% of psychologists vote in elections. So if you have 2.1% of psychologists behind your cause, you can win the election. Um, so it's really easy under the system for radicals to capture these institutions. Really easy because most people are checked out and they don't vote and they don't have time to try to recapture the APA. They have their own career. Um, but clearly the APA has just gotten more and more unhinged on these issues. I mean, my sense is that these are not just false ideas, but actively harmful. I think they hurt the credibility of the entire profession. They discourage people from seeking treatment. I think they can contribute to psychiatric problems. If you think that who you are as a man is a problem, I just can't imagine telling people that. Um, so to me, it sounds not just false, but actively harming patients.
Mhm. Um, and then this next question is related to that. What remedies are available to patients who feel their therapist has mistreated them on ideological grounds?
Um, that's an interesting issue. Like, do you go to a licensing board and file a complaint or something like that? Um, I'm curious. It depends on what happened. I would probably encourage people to just leave and find a different therapist, rather than getting involved in something like that. If you file a lawsuit or something, which you can do, but it's hard to win, and it's probably not worth your time. Uh, I think that the best thing would be to try to find a better therapist. If it was really an egregious act, and you feel otherwise, then by all means you can pursue that. But I think probably for most people, find a better therapist.
Okay, and you kind of touched for us, Andrew, on how saturated the marketplace, if you will, is with therapists who are, definitely going from an extremist orthodoxy and working from that perspective. This is kind of related. So, in terms of finding another, therapist that maybe won't do harm to a person, we have two attendees asking about getting on referral lists. They feel they cannot advertise on Psychology Today or work from a platform that is overtly LGBT driven. Is there a way to be on a referral list from Open Therapy Institute?
Yes, you should contact us. It's info@opentherapyinstitute.org. You can email us. We're looking, because our capacity is limited right now, we're looking for people who have a license in California, New York, Massachusetts, and then PsyPact licenses. That's psychologists who have a license in a PsyPact state are eligible to get a PsyPact license, and they can practice in all of the states. So if we basically get the big states of New York, California, Massachusetts, and then the PsyPact states, we can serve most of the country with a smaller staff. Because we're launching, and we're a startup right now, we we can't manage people who are just licensed in one state and can't get the larger license. But if you have either of those licenses, California, Massachusetts, PsyPact, definitely reach out to us, and we'd be interested to talk to you.
Okay. And then this next question is dealing with Christian counseling. So, to what degree can religion or denomination-based counseling, for example, Christian counseling, meet the demand for therapy that has not been taken over by woke ideology? To what degree has such Christian counseling become co-opted in the same way as secular counseling?
Yeah. Um, Faith-based counseling services exist. There are even entire graduate programs that focus entirely on this. My experience is that they're siloed. They're incredibly siloed. They really live in a totally separate place from the rest of the field. Um, and the people who tend to be very religious patients who want a very religious focused therapy. There are plenty of people who are religious, but it's maybe not what they want their whole therapy to focus on. And they tend to prefer other therapists. So most religious patients don't pursue that route. Um, I don't know a lot about the different denominations of pastoral counseling and which ones might be good and which ones might not be. My guess is it's a mix. A lot of denominations have taken on the same DEI stuff that other places have. I don't know which ones are good and which ones aren't. I think my bigger concern around religion is that religious issues matter to so many patients, but most therapists get very little training on it and are actually quite poorly skilled dealing with religious and spiritual concerns.
Mhm, mhm. Thank you. Next question here about resources. So, are there any resources via Open Therapy Institute or other venues that you are aware of that provide an opportunity to connect with colleagues who are open to these discussions or similar viewpoints?
Yes, these are great questions. I'm glad people are asking these things. I probably should have mentioned this. Yes, if we have a membership at Open Therapy Institute, it's really for providers. If you want to join, you get discounts on our CE workshops. We have members-only events that are going to be community building, discussion-focused events. Um, and um, and there's also an opportunity potentially for therapy referrals that we can't see in our network. So there's a variety of different perks to becoming a member. It's $99 for the year, and you can find it on our website. Just go to it's under the workshops tab at opentherapyinstitute.org. Thanks for asking.
Okay. And just one more that just kind of popped up as you mentioned that the continuing education workshops from Open Therapy Institute, Can you tell us a little bit more about some of those and how it's helping to address some of those overlooked issues or perspectives and patient populations, how it can help people to better, offer more inclusive, authentically inclusive services?
Totally. I should say they're for therapists. So we're accredited by these workshops are accredited by the APA for psychologists, NASW for social workers, and NBCC for counselors. Um, we don't have CMEs at this time, so um, we don't have accreditation for that. They still are probably of general interest to people who work in mental health, even if they have another degree like a nurse practitioner or a psychiatric nurse or a psychiatrist. So we have 4 fall workshops coming up. The first one is basically just overviewing the ways that bias has come into training in the field, the way that it comes into therapy, and the ways that it affects patients. Um, and we'll kind of like go into much more detail than I did today about that. The second one is about self-censorship, and we have 4 speakers. Um, we're talking about how self-censorship might harm mental health and how open dialogue could be beneficial, how self-censorship comes into graduate training, false assumptions that lead to censorship. It's so interesting that censorship is often rationalized with mental health language. It's like it's protecting people who are traumatized from harm or something, or there's all this kind of like pseudo mental health jargon that's kind of thrown around as to why we need censorship. It's totally false. Dialogue is what helps. Censorship is not a good treatment for any disorder, in my opinion. And then we also the last speaker at that talk is can talk about clinical tools that therapists use that can help people who are self-censoring. I'll say really quickly, I can just give a few points there. One is connecting to other people. People who are self-censoring are often really isolated. Isolation is the biggest result of self-censorship. Because you don't know who shares your views. You're kind of alone, even if you have friends, because they don't really know you. So connecting to others is big. The other one is thinking strategically about when, how, and where you want to speak up. Maybe doing it in a group or being thoughtful about how you do it, being assertive. Another one is thinking about the risks of not speaking up. People think about the risks of speaking up a lot. They don't think about the risks of staying silent. And sometimes workplaces get more and more toxic when people don't speak up. Um, another common experience that I think we'll talk about in the workshop is the experience. A lot of people who self-censor, they kind of start to feel like they're going crazy because everybody around them has these beliefs that they don't hold, and they start to second guess themselves. And they can start to wonder how much of what they think and feel is really valid. And it can really kind of mess with your mind. So we're going to talk about all those themes in treatment and how it impacts people. The other 2 talks, we have 2 other talks this fall. One of them is on overlooked cultural issues. We're going to talk about the mental health benefits of humor. We're going to talk about authoritarian personality, and especially in recent times, how that may have grown. And we're going to talk about morality issues. Really quick, the morality issue, there's something maybe especially with social justice movements that there are certain groups that get almost like a terrifying, endless empathy. And then there are these other groups that get an also terrifying total lack of empathy. And there's something interesting about the split between hyper empathy, where it's like if somebody commits a murder or a violent crime, they still get empathy. And then other people who are maybe attacked, no matter how viciously they're attacked, don't get that empathy. So there's something happening around morality or maybe like super ego issues that's really present that we're gonna break down. And the last workshop is about racial and cultural reductionism. We've got 2 really interesting talks about how particularly in training programs and more recently, therapists are being taught almost basically to stereotype their patients and to assume a whole set of values, beliefs, and experiences simply based on the patient's race, ethnicity, or culture. And how to overcome that with therapeutic curiosity and therapeutic inquiry, so that you don't get sucked into making all these false assumptions. The other talk is about people who don't quite fit exactly into a category. They're not, maybe they have a mixed background or they were adopted or, you know, they agree with some parts of one side and some parts of another. So many people are that way. And it can also be really isolating because there's not like this group that you totally belong to the way that some people uh want to feel. And so there's challenges around that too. So those are our four talks. Just it's about bias, self-censorship, cultural issues, and racial reductionism.
Amazing. These sound like amazing sessions, Andrew. And I just want to thank you for giving this insightful presentation on important issues that the mental health field is overlooking. We at Do No Harm appreciate you for attending this webinar, and we will follow up with an email that includes the video of this webinar and a way to reach out to Do No Harm if you have any further questions, comments, or ideas for future webinars. We hope you found it informative and have a great rest of your day.